So let's get started. Monday, of course, is our Medical Monday. It's Medical Monday. Happy Monday. Today's Medical Monday is about transesophageal, I'm not going to say these words right, echocardiography, TEE. What is a TEE? A TEE is a diagnostic test that uses sound waves to create detailed images of the heart from within the esophagus. During this procedure, a small ultrasound probe is advanced through the patient's throat into the esophagus. This is done because the esophagus lies behind the heart. A TEE allows the ultrasound to bypass the rib cage and lungs, therefore, an unobstructed image is created. Usually, physicians order a TEE in suspected valve or aortic disease cases. And below, you can see what a TEE is and the patient going through it. Why is a TEE important in aortic disease? Visualization. A TEE provides unobstructed images of the aortic arch and descending thoracic aorta. Detection. A TEE is especially useful in the detection of aortic dissection. Physicians can see blood flow and tear location by using this diagnostic test. Assessment pre and post surgery. A TEE is used before and during surgical operation. Preoperatively, it's used to understand the unique structure of the patient's aorta. Intraoperatively, it allows for a quick, real-time imaging to assess surgical treatment's success. Valve function evaluation. A TEE can be used to assess function in cases of suspected aortic valve dysfunction caused by aortic disease. Monitoring. A TEE can be used during aortic stent procedures to ensure proper positioning or adjustment of the stent. Its ability to provide real-time imaging is very useful during this procedure. Here's an image of TE. Here's a TE image of an ascending aortic dissection. Are there any risks? The risk of serious problems is low, even though a TEE is considered an invasive procedure. TEE only requires local anesthesia, which consists of a numbing, pain relieving spray applied to the back of the throat. Additionally, medication is given through IV for relaxation. Some patients have a sore throat after a TE, but this usually resolves within a few days or even hours. Although very unlikely, complications such as allergic reactions, aspiration pneumonia, arrhythmias, or minor I cannot pronounce this word, bleeding can occur. Always remember to talk to your doctor about any risks or concerns. That wraps up this week's Medical Monday. Make sure to join us again in 2 more weeks for the next Medical Monday blog post. Have a great weekend and think aorta. Samantha. She writes our medical posts, so that's why I can't say the correct words. And just, yeah, there you go. You got it. And just so you know, I actually have had a TEE and it is very minor. And they did it so that they could determine whether or not there was a blood clot before they did an actual procedure. So it's not difficult at all. It's actually very helpful. So next, um, it wasn't very long at all. I mean, the relaxation medication, I was definitely asleep. I think it was probably done in 15 minutes. And if in the time I was in AFib, so they wanted to get me back into into sinus rhythm, so that's why they did it. So it really was not bad at all. I would rather do that any day than other things, that's for sure.